Dr. Cohen, talk a little bit about, when people have braces and perhaps even the type of, the type of treatment, the Sure Smile treatment you're doing. I think there still are some wires in it. And what about the brushing, the hygiene? I've heard that people with braces really got to be careful, got to be very dedicated to do their job. Otherwise, that spinach keeping hanging in there from a flag post is simply creating gum disease. And gum disease, it's more than just then losing the teeth. It poisons your body, your kidneys, your liver. So tell us what people should be paying attention. Is it a concern? Is it not a concern if they do the right thing? Does your treatment avoid it a little bit because of the way the wires are positioned and all that stuff?
One of the most difficult things I think that we have in orthodontics is making sure that our patients keep good hygiene practices. Nothing worse than having an absolutely beautiful result where the teeth fit together perfectly and they fit perfectly in the face, but have a kid that either refused to brush his teeth or her teeth, or drank too much soda pop or ate too much sugar, and then has white spots on their teeth. We do some things in our practice to try to minimize that. I wish I could say we've eliminated it 100% completely, but we're definitely striving to do that. We use a special sealant over top of the teeth before we put the braces on called ProSeal. That actually, I guess you could almost say it's kind of like a clear fingernail polish, only it is fluoride containing so that it really can help protect the tooth as we're doing our treatment. Also, by being part of Sure Smile, by getting our patients done a little quicker, we have less time in braces. Less time means less chance for problems to develop. And you are absolutely correct about the relationship between overall human health and the oral cavity. Even the American Heart Association now says that periodontal problems, gum disease, and even problems from leaving wisdom teeth partially erupted can cause a lot of problems as you get older with heart disease, stroke, a lot of chronic infection that we all know causes many of the problems that we have today.
Right. Well, I've heard that, people who develop gum disease and again, because wearing braces or having bridges and crowns where flossing and brushing becomes simply more difficult is a door opener to get a gum disease. And here we have ladies, pregnant women getting a premature baby born underweight. In California, there was even a stillborn baby because they found the placenta of the gum disease. They found the gum disease in the placenta. And now, grant you, well, first of all, you do lots of adult orthodontics, so you're right there. And even though the children don't necessarily get babies throughout when they're 16, 17 and have the braces. But at the same time, if it does something so drastic, wouldn't it put down the immune system? Wouldn't it be making you more suspected to your next flu season, be it a bird flu, a swine flu, or be it just the winter flu? Right or no?
Well, yeah, any type of chronic infection lowers your immune system. Your body has to try to fight it all the time, and your body only has so much energy that it can devote to doing those things. And we do have a number of our patients that are pregnant that we work with. Usually they don't start out that way. They somehow through treatment, a lot of our adults do end up having babies, and we still deal with it pretty well as long as our patients do exactly what we ask as far as keeping things really clean, being a little bit more meticulous and making sure that everything's healthy. Really is usually not a problem for us.
So basically what you're saying is, yes, any type of ortho treatment does put a little strain on cleaning and brushing a little more. You need to do more of it. You need to be more dedicated than if you don't have them. But it's a price you just simply got to pay, because otherwise you pay the price of gum disease, and that in itself is kidney, liver, immune system, and just an overall clogging up of the arteries, and it's just not good.
Yeah, that's absolutely true. I mean, the major problem with tooth loss and health problems as you get into your 40s and 50s is from gum disease. And one of the most important things to prevent gum disease is the ability to clean your teeth. If you have a lot of crowding, a lot of crossed over teeth, that's almost impossible to clean them. So straight teeth, again, not only looks nicer and looks a lot prettier, but it also helps health-wise to allow you to clean much, much better and more efficiently.
Wonderful. Thanks a lot, Dr. Cohen.
Thank you, Helmut.